Welcome back to our health-focused YouTube channel, Dr. Balaku. Today, we're diving into a topic that affects more people than you might think. Lateral epicondylitis, commonly known as tennis elbow. Don't worry, you don't need to be a tennis pro to experience it. Whether you're an athlete, an office worker, or someone who just enjoys DIY home projects, this condition can sneak up on you. In this video, we'll demystify tennis elbow and provide practical tips to prevent it and alleviate the pain if you're already dealing with it. Let's jump right in. Segment 1. What is tennis elbow? Lateral epicondylitis, commonly known as tennis elbow, is a painful condition that affects the outer part of the elbow. To understand it, let's break it down into anatomy of the elbow and causes of lateral epicondylitis. Anatomy of the elbow. The elbow joint consists of three bones: the upper arm bone, humerus, and the two forearm bones, radius and ulna. The lateral epicondyle is a bony bump on the outer side of the humerus near the elbow joint. Tendons connect muscles to bones, and in this case, tendons from the forearm muscles attach to the lateral epicondyle. Let us understand the causes of lateral epicondylitis. Lateral epicondylitis occurs due to overuse or repetitive strain of the forearm muscles and tendons that attach to the lateral epicondyle. Common activities that involve gripping, twisting, or repetitive wrist and forearm movements, such as tennis, typing, painting, or lifting, can lead to this condition. The repeated stress on these tendons causes small tears and damage, resulting in pain and tenderness on the outer part of the elbow. Segment 2. Recognizing the symptoms. Pain. The most noticeable symptom of tennis elbow is pain, which occurs on the outer part of the elbow. This pain can range from mild discomfort to a severe, burning sensation. It often intensifies during activities that involve gripping or lifting objects. Tenderness. There is tenderness when pressure is applied to the area around the lateral epicondyle, the bony bump on the outer side of the elbow. Even light touch can elicit discomfort. Weak grip. People with tennis elbow often experience a weakened grip strength. Simple tasks like shaking hands, holding a cup, or turning a doorknob may become challenging due to the pain and weakness. Stiffness. Some individuals with lateral epicondylitis may notice stiffness in the elbow joint, especially in the morning or after periods of inactivity. Pain radiating down the forearm. In some cases, the pain from the lateral epicondyle can radiate down the forearm, affecting the muscles and tendons in that region. Difficulty with activities. Activities that involve wrist extension and forearm rotation, such as gripping a tennis racket, using tools, typing, or even lifting a lightweight object, can exacerbate the pain and discomfort. Pain with repetitive movements. The symptoms of tennis elbow typically worsen with repetitive arm motions. For instance, playing sports like tennis, using a computer mouse for extended periods, or performing repetitive manual labor can aggravate the condition. Segment 3. Who's at risk? Individuals at risk of developing tennis elbow typically engage in activities that involve repetitive arm and wrist movements. Common risk groups include athletes, tennis players, of course, are at risk due to the repeated gripping and swinging motions. However, any sport or activity that involves similar actions, like racquetball or squash, can also pose a risk. Manual laborers, jobs that require repetitive arm and wrist movements, such as carpenters, plumbers, painters, and mechanics, put individuals at risk. Office workers. Prolonged computer use and poor ergonomics, including improper keyboard and mouse placement, can increase the risk among office workers. Musicians. Musicians who play instruments like the violin, guitar, or drums, which demand repetitive hand and wrist motions, may develop tennis elbow. Gardeners. Frequent use of hand tools and gardening implements can contribute to the development of this condition. Hobbyists. Individuals engaged in hobbies or projects that involve repetitive gripping, twisting, or lifting actions can be at risk. Age and gender. While tennis elbow can affect people of all ages, it's more common in adults between 30 and 50 years old. It can occur in both men and women, although it's somewhat more frequent in men. Segment 4. Prevention is key. Preventing tennis elbow involves taking steps to reduce the strain on the forearm tendons. Here are some of the ways to prevent tennis elbow. 1. Proper technique. Whether you're playing sports, typing, or using tools, learn and maintain proper techniques to reduce stress on the forearm muscles and tendons. 2. Ergonomics. Ensure your workspace is ergonomically designed, especially if you work on a computer. Adjust your chair, keyboard, and mouse to promote a neutral wrist position. 3. Stretching and strengthening. Incorporate forearm and wrist stretching and strengthening exercises into your routine to improve flexibility and muscle endurance. 4. Warm up. Before engaging in activities that involve repetitive arm movements, warm up with gentle stretching exercises to prepare your muscles and tendons. 5. Use proper equipment. Use tools, sports equipment, and devices that are suited to your size and strength. Grips that are too small or too large can increase the risk of injury. 6. Take breaks. If your job or hobby involves repetitive motions, take regular breaks to give your muscles and tendons time to rest and recover. 7. Avoid overexertion. Don't push yourself too hard during physical activities, especially if you're not accustomed to them. Gradually increase the intensity and duration of your workouts. 8. Use braces or straps. Consider using braces or straps designed to support the forearm during activities that may strain the tendons. Please read the description for links to some of the elbow support products. 9. Proper equipment maintenance. Ensure that tools and sports equipment are in good condition and well maintained. Faulty equipment can increase the risk of injury. 10. Listen to your body. If you experience early symptoms of tennis elbow, such as pain or discomfort in the outer elbow, rest and seek treatment promptly to prevent the condition from worsening. Segment 5. Treatment and relief. Treatment and relief for lateral epicondylitis typically involves a combination of self-care measures and medical interventions. In short, it is called RICE method. 1. Rest. Give the affected arm and elbow adequate rest. Avoid activities that worsen the pain and try to minimize repetitive movements. 2. Ice. Applying ice to the affected area for about 15 to 20 minutes several times a day can help reduce pain and inflammation. Be sure to use a cloth or towel to protect your skin from direct contact with the ice. 3. Compression. Wearing a brace or strap designed for tennis elbow can provide support to the affected tendons and alleviate strain. 4. Elevation. Keeping the arm elevated can help reduce swelling and promote healing, especially when at rest. Pain medications, physical therapy, corticosteroid injections, extracorporeal shock wave therapy, platelet-rich plasma therapy are some of the added measures that one can think of. Surgery. Surgical intervention is usually considered as a last resort when conservative treatments fail. The procedure involves removing damaged tissue from the affected tendons. Segment 6. Lifestyle adjustments. Lifestyle adjustments for lateral epicondylitis involve modifying your daily activities to reduce strain on the affected tendons. Here are some lifestyle adjustments that you can consider. 1. Rest and avoid aggravating activities. 2. Ensure proper ergonomics at work and home. 3. Choose tools, sports equipment, and devices that are ergonomically designed. 4. If you play sports or engage in hobbies that involve repetitive arm movements, work with a coach or instructor to improve your technique. 5. Modify your daily activities to reduce the repetitive use of your arms. 6. Use assistive devices. Utilize assistive devices or ergonomic aids, such as jar openers or ergonomic gardening tools, to reduce the strain on your forearm tendons. 7. Proper warm-up before engaging in any activity that involves repetitive arm motions. 8. If your job or hobby requires repetitive motions, take regular breaks to rest your forearm muscles and tendons. 9. Ice and compression. 10. Listen to your body. Pay attention to early signs of discomfort or pain in your elbow and seek medical attention accordingly. 11. Rehabilitation exercises. Continue with any prescribed rehabilitation exercises or stretches, even after the initial pain has subsided to prevent recurrence. Conclusion. Thank you for joining us today as we uncovered the mysteries of tennis elbow. Remember, lateral epicondylitis doesn't discriminate. It can affect anyone who uses their arms repetitively. However, armed with the right knowledge and preventive measures, you can reduce your risk and manage this condition effectively. If you found this video helpful, please like and share it with friends or family who might benefit from this information. Subscribe to our channel for more health and wellness tips, and as always, stay well.